Welcome to episode 8 of the Studio DOHC podcast. My name is Brian Hodgkins, and I'm the Executive Vice President of Clinical Operations here at Desert Oasis Healthcare. And I'm glad to be back on a new episode with one of our fabulous members and guest, a well-known broadcast journalist, Patti Patane. If you watched the first episode of our new TV show, The Pulse, you saw Patti there as well. I'm happy to say she's agreed to share more of her journey with us today as both a member of Desert Oasis Healthcare, but also she brings an interesting perspective on a variety of interesting topics on seniors and Medicare and how DOHC is improvising and improving technology for the future. So we're going to flip the script today, and we're going to have Patti kind of rejoin her career in broadcast journalism where she started. And you probably recognized her on television in the local market over the years. Tell us a little bit back about how you got started and how long you've been doing it, and then we'll let you do what you do best.
Well, I've been a broadcast journalist for 53 years.
Oh, that's all?
Yeah, that's it.
A short stint.
But I'm finding something that is very interesting in this business and every business. When you pass 75 and you're pushing 80, there seems to be a decrease in what is expected of you and a decrease in what you can and cannot do. In other words, how many jobs are out there for 80-year-olds? And how do you handle this enormous surge of seniors that you're getting, because seniors are soon to outnumber people under the age of 18. That is a growing market, is a huge market. And just here in the Coachella Valley and the high desert, which is considered your region for this main campus of the Desert Oasis Healthcare, you're going to have an enormous influx of seniors, and it's going to continue to get bigger and bigger and bigger. How are you handling it? I mean, you've got 32,000, am I correct? 32,000 seniors here in the Coachella Valley and the high desert that you care for?
Yes, we do. And you know what? We cherish each and every one of those seniors. And you're right. We've been watching what we call the graying of America for quite some time.
White.
The whiting of America,
white.
Right.
You're gray, you're almost white, but when you get white, you have to earn the white.
There you go. So, but we've been watching this trend even in the Coachella Valley. And so if you think about it, we take care of nearly one in every 3 seniors that's here in the Valley. We're responsible for some degree of their care. And so we are always trying to be nimble and expand our services directly to take care of what I think is the most important segment of our population, and that's the senior who we know is going to have chronic conditions. And you talked about as you get older, you know, your body takes the wear and tear of a lifetime.
They start to break,
There
Brian.
you go.
They start to break. My voice is broken, and we're going to talk about that because I was floored when I found out that I had to go to a doctor in San Diego at the University of California at San Diego University. You covered me. How do you make arrangements like that so far out?
Well, that's what we do. You know, when we're truly in the healthcare business, and as I said, you know, our focus really is maintaining the health and wellness of our senior population. We have a lot of commercial lives as well, but there's just something special about taking care of people that remind you of your mother or your father. And I think that's a great tribute to how we view healthcare. We want you to, you know, my mother-in-law uses us. My mom used us when she was alive. And so I think if you feel comfortable sending people to an organization like us to take care of your seniors, I think that's a true testament to what our mission is.
Well, I talk to people all the time about Medicare and their health care and who they have as their HMO, which, I mean, after listening to months of somebody trying to sell us, you know, a new policy, let's understand something. You've got Medicare, then you've got your health management organization right under that.
Right.
And the health management organization is Desert Oasis Healthcare. As far as I'm concerned, it's the only HMO in the entire region.
Yeah, so we're a medical group, and what they call us is we're full risk, meaning that we work with insurance companies. They give us the full responsibility to manage the population that they hand us, everything about it, from you know, everything about their healthcare decisions to how they live, and really then at the end of their life spectrum, how do they want to die? So we try to cover everything in between. And you're right. If you look at our senior population, this is national data. but the average per capita income for most seniors is under $25,000 a year.
Yeah, the average Social Security is $1,500 a month.
Right. So you can imagine if you're really trying to live on that budget, you need to make smart choices about everything. And healthcare is one thing that I think is the most important decision you make because that really tells how you're going to live and spend the best part of your life, as you get older. And so we think that Medicare Advantage is a good model because it actually provides more benefits than Medicare. It lowers your out-of-pocket cost. And you get a group like ours that really provides so many programs that you don't have to worry about where do you go for care next. You can get everything here under the Desert Oasis roof.
Now, I'm finding that because every time I ask for something or I need something or I ask you a question, you've got it covered, which is what floored me about the University of California at San Diego when I needed to go down and get my vocal cords fixed, which is that they're working on it. My voice still isn't back completely, but it's getting there. Well, and I was surprised that you were able to reach out all the way to San Diego and have me covered.
Yeah, so a lot of people don't realize this, but the Coachella Valley is not a medical desert, but when you really look at the amount of primary care physicians per 100,000 population, we're only at about 40. That number should be double that. And so really, even though we have great institutions and hospitals here and a pretty much great healthcare system,
yes,
we lack some of the specialists necessary to provide all the care. And so we work with tertiary centers like Cedars-Sinai or UCSD. And so sometimes when we don't have expertise here, like an ENT that can inject your vocal cords to get them plumped up so you sound
right,
like the old Patti Patane
right,
of yesteryear, we have to send people where the care is best provided. And sometimes that means, unfortunately, going to San Diego. Not everyone wants to go and leave the valley, but you'd be surprised how many things we can't do here. And so we need to find where that care can be provided.
I found one thing you can't do here, and that was fix my vocal cords. And that was in San Diego. And I'm going back for a second injection. This is a recent article, came out just a few days ago. The World Health Organization has declared loneliness a global public health concern. The older you get, the fewer friends you have because they die. I'm going through that myself. I have lost every old friend I have had for the past 54 years. They're all gone. Now, they were a little bit older than I was by about 15 years, but the people I talk to that are getting closer to 80, which is where I'm at, these losses are monumental. It seems it's harder the older you get, the loss is greater.
Yes. And we've talked about this before. And I lean in and I say, I'm sorry for that. And you know what? Loneliness is one of the most serious conditions across, and this is a worldwide problem, is the disconnection between our seniors, and not just seniors. I think a lot of elements of our population are disconnected from each other, their community, their neighborhood. And we really focus on that. We have a special team called the Help Team that literally tries, if we have a senior, one of our members, who hasn't seen a doctor and we have difficulty reaching out to them because we want them to be seen annually, we'll send someone to the home, introduce themselves, and find out why they're not connected.
You'll actually send a member of your staff to one of your members' homes that you haven't been able to connect with.
Yeah, we do wellness checks, but we want to connect these. Why won't you come to the doctor? We've called a couple times. Is it transportation? We can fix that.
What do you mean, how can you fix the transportation?
Well, because, in Medicare Advantage, almost all these plans come with a transportation benefit. And we have someone that does nothing but find transportation so patients don't have to worry about how they get from the hospital home or from home to the hospital without calling an ambulance. You don't want to have to go with the sirens going.
That's something I did not know you arranged here was transportation. I had no idea because I have Medicare Advantage.
That's correct.
And when they're trying during the period where that open enrollment where you can be inundated with every advertising.
Yeah, you said your mailbox is so stuffed you could barely open it.
I got so much in the mail recently that it's just, I can't even get through it. And as far as I'm concerned, I have United Healthcare Medicare Advantage. And when I needed it, I found out it was the best really there is as far as I'm concerned. You like Medicare Advantage, United Healthcare Medicare Advantage. because it's so thorough. It covers all the bases. And I have yet to find anything that you don't take care of.
Well, so kind of revisiting the Medicare Advantage and why we're so big on it is once again, if I'm straight Medicare, right? I've aged into Medicare. I'm 65. I get my Part A and Part B, and I pay my premium. Right, it comes out of my Social Security check.
Correct.
That's all I get. If I want to, then I have to buy a drug benefit. So if I want to go to the pharmacy and I'm on medications, I have to buy a Part D benefit separately.
Yeah, see, that all got very confusing to me in the very beginning.
Right.
And I just I got lucky. The very first person I went to 15 years ago to get my Medicare, it automatically signed me up. And I've been on United Healthcare Medicare Advantage for as long as I can remember.
Right.
And I've really never had to pay for much of any. I had to pay for one prescription, and it was like $35, and it only used it for a little while. It didn't work. So I really don't pay for much of it. I don't pay for anything.
Right.
Because I have Medicare Advantage with Desert Oasis Healthcare.
And that matters. You can get Medicare Advantage, but you could be with a different medical group that is not as broad as ours, that is not as in-depth and not as, I think, organized and caring. But we've talked about this. We've done broker shows. We have some very trusted brokers that help people like yourself find and navigate through that Medicare Advantage maze every year. But once you're connected and you feel comfortable with the breadth of benefits you get, hearing aids, dental coverage, vision, everything else that separately, buying healthcare a la carte in Medicare fee-for-service to me is expensive.
Very.
Very expensive. And people say, well, I get to go whoever I want to go to. In our network, we have the broadest specialist network. It's the same network, guess what, that these people who have Medicare fee-for-service are using. We're connected with Eisenhower.
But the fee-for-service people are paying $3,000 just for the right to be able to get in and pay more.
That's correct. And always 20% and always 20% and always 20%. So, yeah, I think there's unique and I think smart advantages to Medicare Advantage.
Well, and I hope that the people out there that have just now come on to Medicare, that I hope they were smart enough and got enough information and got enough good advice to get the Desert Oasis Healthcare as their HMO, because as far as I'm concerned, it's the only HMO in the region that is doing what you're doing and doing it as well as you're doing it. And you're taking very good care of me, and I'm sure you're taking very good care of everybody else.
Absolutely. That's our mission.
Well, you're accomplishing it.
All right. Thank you, Patti.
Thank you, Brian.
It's a predictor of a very poor quality of life. And oftentimes,
okay.
And oftentimes, okay. I was getting attacked by something.